actually a pretty good sign. If people who are re-exposed and get reinfected have fewer symptoms or no symptoms whatsoever, that would be a tremendous win.
A positive spin on a seemingly alarming development. A healthy 33-year-old man from Hong Kong is the world's first case of COVID-19 reinfection, catching the bug months after his first bout. And despite reports of 2 other cases of reinfection out of Europe, this doctor is remaining optimistic.
It looks like this individual's immune system did exactly what it was supposed to do, and it's re-exposed to a virus. So it's really helpful to see. It's actually wonderful to see this in a real world setting.
The unnamed patient in Hong Kong was first infected in March and experienced mild symptoms before being discharged in early April. Then, after a recent trip to Spain, the young man tested positive again on August 15th with a different strain. Bogosh believes that there will be more cases of reinfection like the 2 in Europe, but doesn't believe this should have any impact on vaccines and their development. But there are other questions he's anxious to get answered.
What we don't know is how likely this individual could transmit this infection. I think that's one of the key questions that really needs to be addressed.
Now, these cases of reinfection are raising questions about immunity and how long a person can remain immune after recovery or even after being vaccinated. The World Health Organization trying to squash those fears.
But we need to not jump to any conclusions. To say even if this is the first documented case of reinfection, it is possible, of course, because with our experience with other human coronaviruses and the MERS coronavirus and the SARS-CoV-1 coronavirus, we know that people have an antibody response for some time, but it may wane.
In Ottawa, Nigel Newlove, City News.